Healthcare in America. Scary, right? The mere mention of the word healthcare in America not only creates confusion, but also evokes very strong emotion. Simply, yet unfortunately put, many Americans are uninformed, if informed at all, about their healthcare options. And if you've turned on the news recently, you know that this issue has particularly risen with the spreading of COVID-19 globally. So questions surrounding healthcare in America include who's eligible to be covered, the extent to which they are covered, and most importantly, how much does it cost and who should pay for it? Answers to these questions are not universally agreed upon in America and have thus created a rift, to say the least, among political parties, communities, and societal classes. Today, I am arguing that administrative power should be done away with because it results in prolonging simple processes, thus taking far longer than they should to complete. In addition, I am arguing that Medicare should be done away with because it unnecessarily increases the price of prescription drugs. Lastly, and most importantly, I am advocating for the expansion of insurance coverage to all Americans in the form of universal health care. So who is eligible for coverage? In America, your household income can be directly linked to having insubstantial health insurance. Our country claims to have free health care for those who need it. However, oftentimes, one's income is too high to receive Medicaid or assistance, yet too low to comfortably exist without the threat of large medical bills. Simply put on healthcare.org, it states, if unemployed, you may be eligible for free or low-cost Medicaid. However, the issue with this is that it caters pretty much only to the unemployed or extreme lower class, while leaving the lower to middle class to be notably taxed while hardly receiving the benefits needed to support their own family. Furthermore, race can also determine the type of healthcare one receives in America, unfortunately. Lillian Thomas, author of Poor Health, Poverty and Scarce Resources in U.S. Cities, states an issue. Many doctors have been relocating to areas that house people with steady health insurance instead of remaining in areas with high healthcare needs and demands. So, in simpler terms, doctors are choosing to practice in areas with higher household incomes. When hospitals in a community dwindle in size, doctors disperse too. This is happening typically in neighborhoods where people are isolated by poverty. With the decrease of healthcare providers' presence in lower income areas, it has become evident that, begin quote, poor people are more likely to be in poor health. Indeed, poverty itself can make people sick, end quote. Lillian Thomas. Individuals and whole families are being left behind and not receiving the primary care they need because doctors are choosing to practice in lower income neighborhoods. Because they are choosing not to practice in lower income neighborhoods. My apologies. So, is our Medicare even really equal, and is it really free? Because even if one qualifies, money is still having to come out of one's pocket. One might receive tax credits and savings on deductibles, co-payments, or other miscellaneous fees, but some may still have to pay a premium. Does wrapping one's head around this seem daunting? If you're like me, the answer is yes, and this confusion is causing inequality. So why is healthcare in America so expensive? Healthcare in America is twice as expensive as it is in any other country because of 4 key factors: a lack of insurance coverage, the cost of drugs, administrative inefficiency, and underperforming primary care. The biggest issue revolving health insurance is the cold hard fact that people lack insurance because it is simply not affordable in America. Studies showed that in 2006, more than 27 million people in the United States were uninsured, which is about 1/10 of the population. The cost of drugs plays another key role in why America's healthcare system is so inefficient yet expensive. The biggest difference between America and most other countries' healthcare systems is the way in which our drug prices are determined. Our Congress here in America created something titled Medicare Part B, which continues to give most income to the government, which one could and should, and I do argue, is unjust. If this section of Medicare didn't exist, the government would simply negotiate prices with the distributors, private companies. resulting in much cheaper drug prices. And it would pretty much benefit all Americans, including doctors, because the more accessible a drug is, the more accessible it will continue to be, therefore putting more consistent and regular pay into doctors and other healthcare providers' pockets. But unfortunately, because of Medicare Part D, drug prices will always be higher in America. Administrative inefficiency is also a problem within the American healthcare system. Administrative inefficiency can be defined as simply spending too much money in the healthcare processes and wasting too much time on billing and insurance. By instead relying on private health insurers, we could minimize this issue by having reasonable and predictable copayments. In conclusion, there are many factors as to why healthcare in America is failing greatly. Lack of insurance coverage, drug cost, administrative inefficiency, and underperforming primary care. And there are many links that need to be taken in order to improve our current healthcare system. And my argument is that we need to do away with all the administrative power because it results in simple processes taking far too long. We need to do away with Medicaid because it is increasing the prices of our drugs by the day. And lastly, we need to expand insurance coverage to all Americans because united we will stand and divided we will fall.